Our next presentation will be Vicero Incorporated. Vicero is pioneering the development of next-generation nanobody therapies to address unmet medical needs. Their work includes customized delivery systems to enhance safety and reduce risk, a diverse library of development candidates to maximize the probability of success, and a novel technology platform. Please welcome founder and CEO, Dr. Vikram Kansra.
Thank you, Matthew, and good morning to you all, and happy to be here and share the Vicero vision. Vicero, by definition, is derived from a Latin word that means to conquer. And we are right in the midst of one of the hottest areas in oncology, which is immunotherapy. And Vicero's aim is to reshape immunotherapy. And the reason we want to reshape immunotherapy is because while immunotherapy is effective, immunotherapy is not cost effective. Oh. It's not going to the next slide. Okay. And the way we plan to do this is using a revolutionary technology called nanobodies. And nanobodies, as we like to call them internally as smart antibodies, these are fragments of antibodies that can be used to bind multiple targets and then deliver a pathological response. So let's look at the problem. Immunotherapy works, but it's not cost effective. Drugs like Keytruda, they cost about $150,000 a year for treatment. Patients typically are put on a single monotherapy because the cost of combination is prohibitive. And that's really sad. Science should be driving how the therapeutic options are chosen and not costs. And this is where nanobodies come in. Because nanobodies, A, they're cheap to make. B, they are highly potent. So the dose required to deliver pharmacological activity is very low. And most importantly, we can actually make combinations of nanobodies and thereby engage multiple targets and basically reverse the pathology. The market size and the opportunity is huge. Just the 4 drugs on the right show today that they make sales of about $45 billion and are expected to grow to about $70 billion. And within Vicero's portfolio, we actually have nanobodies for each of these, leading drugs. So we believe that with our combination approach of the nanobodies, that we're going to basically change or reshape how immunotherapy is going to be implemented. Here is an example of a nanobody. It's a simple cartoonistic representation, but basically it shows the idea. It's a small fragment, and you can actually join these fragments and thereby engage not just one target, but 2 targets or even 3 targets simultaneously. As a company, we are very deeply rooted in science. We have collaborations with some of the best and brightest universities and minds who are working very closely with us. We have a very strong IP position, and we are expanding our IP real estate. From a series or a funding strategy, we're basically looking to raise a Series A today, and the amount that we are planning to raise is about $30 million. The seed funding for the company has been, done by myself. I've put in about close to $1 million, and the reason for that is because the science is stellar, and we believe that we are about to change how immunotherapy is going to be implemented. As a team, this is a very seasoned team. We brought 10 drugs to the market, some of the best drugs, blockbuster drugs, and myself and my co-founder, Juan Carlos, we are very committed to getting Vicero not just funded, but basically bringing these assets to the clinic and to the patients. As I mentioned previously, we are looking to raise $30 million. We want to actively move 2 of our lead programs rapidly into the clinic, and we have a roadmap to achieve this. We want to file an IND within 12 months, complete a proof of concept within 24 months, and file a BLA within 5 years. As a team, we've done this before for other companies, and we're going to do it for us as well. Thank you.